हेलो एवरीवन, वेलकम टू माय चैनल। अगर आप डेंटिस्ट्री से रिलेटेड इंफॉर्मेटिव वीडियोस देखना पसंद करते हैं देन प्लीज़ सब्सक्राइब टू माय चैनल एंड प्रेस दैट बेल आइकन सो दैट जब भी मैं कोई वीडियो अपलोड करूँगी यू विल गेट नोटिफाइड। अभी बिना किसी डिले के लेट्स गेट बैक इनटू द वीडियो। इफ़ यू आर समवन एक्सपीरियंसिंग सिवियर टूथ पेन एंड जस्ट वांट टू गेट रिड ऑफ योर टूथ, ट्रस्ट मी, you might regret your decision later. Whether to go for a root canal treatment or extraction, that is removal of your tooth, is still a debate, and many of us find it difficult to take a decision between these two treatment plans. I'll try to explain both the treatment procedure to you, and hopefully this will help you all in making decision regarding your treatment. If your dentist, after examining your tooth condition, suggests RCT, that is the root canal treatment for your tooth, then it is always better to proceed with the RCT treatment rather than extracting or removing your tooth. So what is this RCT or root canal treatment? Root canal treatment is a procedure to save and treat the infected tooth. That is the infection reaching the pulp space where nerves and blood vessels are present. To make it more clear, this is the anatomy of the tooth. The upper portion which is seen in the oral cavity is the crown portion and the lower one is the root. The tooth consists of enamel, dentine and pulp. The pulp space is the area where nerves and blood vessels are present. This was just to make you understand the parts of the tooth structure. As you can see, it's an infected tooth in which the decay that starts from the crown portion slowly extends to the pulp space, thus infecting the pulp tissue where the nerves and blood vessels are present. When we, the dentist, perform root canal treatment, we make sure all the decay from the tooth structure is completely removed and the pulp tissue is extirpated or eradicated completely from the root canal space, and the root canal space is properly cleaned and shaped. This is followed by filling the root canal space with an inert material called the gutta percha, and in some cases post is given for additional retention, which is followed by a permanent restorative material. Finally, crown is placed on top of the tooth. Now when we talk about extraction, many of us still prefer extraction because it is easy and quick way for pain relief. And of course, less amount and time is needed for extraction when we compare it with the root canal treatment. But have you ever wondered what will happen to the extraction space once you have removed your tooth? Yes, you need to replace the space in order to prevent drifting or movement of the adjacent and opposing teeth into the extraction space. Here you can see supra-eruption of the upper tooth, that is, the upper tooth is trying to move downwards into the extraction space. So the next question is, how do we prevent all this from happening? The simple answer to this question is by replacing it. And this can be done by partial dentures, crown and bridges, and of course the implant. Implant is actually the best option, but there are certain limitations and certain criteria are to be considered. So it's always better to discuss with your dentist the pros and cons of your treatment and then proceed with the replacement of your tooth. So till now I gave you a brief idea about the pros and cons of root canal treatment as well as extraction. So if you're planning to do extraction, in long run it will cost you a lot of money as well as time. On the other hand, with the use of advanced technology in dentistry, RCT can be done in painless and much comfortable manner. The most important thing to be considered is the root canal treatment saves your natural tooth, and it also prevents any shifting of your adjacent tooth or any bone loss. And of course, it is less expensive in long run. In my opinion, if your tooth can be saved, it's always better to go ahead with the root canal treatment. Don't wait for your tooth to get worse and consult your dentist as soon as possible and make the right decision. Make sure to visit your dentist once every 6 months in order to maintain a good oral hygiene. I hope this video was helpful to all of you. If so, please subscribe to my channel to see more such videos.